If you were to put mothers and children that die in Nigeria, it will be one plane load every hour.
Well, sometimes a woman delivers inside this market. If a woman is delivering, we just go and buy a razor here and a thread and cut it. That is how we do here.
If you hear the number of deaths for women in a week or in a day, it's horrible.
600,000 plus children that die every year in Nigeria.
We want them to pass the bill. That is why we are all here. Everybody, everybody.
When we started working on the health bill, we realized that, okay, there was already a number of people working on the bill, but it was not very well coordinated in terms of everybody coming together to do one thing with one voice on the issue of the health bill.
The Health Sector Reform Coalition is a group of organizations interested in ensuring that Nigerians have access to affordable health care.
Everybody has his own area of specialties. You know, we bind them together and they are very helpful. They have been able to expose us, to tell us what is happening. Most of us don't know, but with the coalition they are working with us, now we know.
The greatest impact that the health bill will have is to strengthen the health system. But not only will it increase funding, it will allocate specific amounts. For example, we'll allocate the percentage that will go to primary health care, to basic drugs and infrastructure, to training and retraining, to vaccinations and immunization programs, you know, so it's very specific.
There must be a legal framework for the policies and the program. And therefore, as part of their project, they felt that there was need to develop a national health bill in Nigeria.
It's a good starting point for us to be able to hold government accountable, to be able to set certain standards.
Save the Children is an important partner in what we're trying to do in Nigeria. When we conceived the idea of saving 1 million lives, for instance, one element of it is malnutrition. Childhood malnutrition accounts for a large chunk of the morbidity and mortality we see in our children. Save the Children stepped up and supported the Nutrition Summit and has worked with us over time. So as a civil society organization, it has been able to come in a way that has helped move an agenda that is very critical to our effort to save lives of children.
The bill actually is focused on delivering the MDGs. There's no other organization better positioned to deal with NDG 4. We also know that Save the Children has a lot of skills in advocacy, so there's no, why shouldn't we tap into something that is already there?
This was one of the texts, one of the adverts that was sent by the Health Sector Coalition on reminding the President to sign the bill before the General Assembly.
I was reading a newspaper and I saw a call for Nigerians to send messages calling on the President to assent to the National Health Bill. And when I followed up, I discovered that a lot of Nigerians sent so many messages, even more than Save the Children could carry at that time.
If you see some of the messages, Mr. President, please save our lives by signing the National Health Bill. Dear Mr. President, please kindly sign the National Health Bill into law to safeguard the life of millions of mothers and children. I remember at one of the meetings, the president of the Market Women Association was saying that we are not interested in getting this bill passed, and we were like, that's why we are here, that's why we have been having these meetings, we are spending all this money, how can you say? She said, no, you don't want the bill passed. If you want the bill passed, you will have a rally.
I will never forget that day. Even people from Nasarawa and nearby states came to join me, came to join Market Women in FCT, you know, to make sure that they passed the bill. We went there, we marched to National Assembly, we went with our bare hand. And with the bare hand that women went with, we conquered them. We told them that we want this bill to be passed. Let us live. Let our children live. Let our unborn children live.
There is a time market women demonstrate about the bill. We marched to the assembly. Even the pregnant woman, unpregnant woman, everybody was there. From morning we are there. When I look at the Nigerian women, they come out massively to come and beg, crying that the judge should just pass this bill. Millions of women are dying every day with small children. So please, they should help us and pass this bill so that women will have life.
I think it's the power of mobilization, because I think it's purely the effort of the women that marched the National Assembly that got the bill passed.
I wish to humbly welcome you all to this public hearing. As of today, the health industry in Nigeria is left largely unregulated, without norms and standards, lacking protection of health users and health providers. The National Health Bill is expected to close the gap, providing the legal framework needed in the regulation, development and management of the national health system.
We would like to complete as quickly as possible, and we'll send it to the President, and we are very optimistic that the President at this time will sign this bill into law.
If this bill passes, I think the rate of death in Nigeria will reduce in terms of pregnancy, because everybody will go to the hospital and collect drugs free and see a doctor free. And some children, malnutrition has catch so many children. If you go to a rural area, you know what I'm talking about.
I'm not fighting for my own. I'm fighting for the ones behind me. You see, I don't deliver. But my children deliver. Nigerian children deliver every day. If you go to the hospital today, many people will deliver. So this cause is a genuine cause that I must fight. I'm going to fight it to the end.